Is it the cold or is it the flu?
That's a good question, Andrea. Sometimes some symptoms of the common cold overlap with those of the flu. That's why it's important to be able to tell the difference.
On today's Health Talk, we'll discuss the common symptoms of colds and of the flu so you can be an expert in telling them apart.
And that can be important to your health. So stay tuned to Health Talk. We're up next. Hello, I'm Dr. Eric Mazer.
And I'm Dr. Andrea Peterson. Today we're going to talk about influenza or the flu versus the common cold.
Our guest today is Mr. Bob Bepko, Administrative Director of Pharmacy Services, Western Connecticut Health Network.
Welcome back to the show.
Thank
Always
you.
a delight to have
Thank
you
you.
here.
It's going to be so much fun because both Andrea and I feel passionately about this topic. A flu is not a bad cold, is it?
That is correct. Don't get them mixed up. There's a big difference.
When we talk about the flu, we are talking about the specific virus influenza, and that can cause really significant illness.
It has the potential to be deadly. It is not self-limiting like a cold. You've got to be careful if you do come down with influenza, especially if you have other health conditions. You've got to watch out if you've got youngsters now with that. The recommendations of people getting inoculated for their infants and stuff. So it's important.
You know, I think over time, people have come to use the word flu almost to mean a viral illness. They talk about the stomach flu, the summer flu, the flu is a bad, and that's wrong medically. But it also has certain implications because influenza, there are specific treatments for it, there are specific ways to prevent it. So let's try to clarify this for people at home. What is influenza?
Well, influenza is an illness caused by a virus, influenza virus. It can be potentially very dangerous. It comes on rather quickly. You could go to bed at night and feel fine and have your whole day planned or weekend planned for the next day, and then you get up and you feel like
sick.
you can't move.
And this is opposed to a cold. I think most people recognize cold. You may get a scratchy throat for 2 or 3 days.
You may
then
feel your nose starting to run, your eyes may be a little watery, but you feel it over several days, and you can say to yourself, I think I'm getting a cold. Where with the influenza virus, it just comes out of nowhere and hits you. And
you say you're sick. Well, what are some of the manifestations of being sick with the flu?
Well, it's that total body ache that you feel like you've been run over by a truck.
Literally.
Literally.
Severe aches.
Severe
often.
aches and pains. And it's, you may even have trouble rolling over in bed because you feel so achy. And you can't pick your head off the pillow.
And
aches and fatigue. So
aches
bad aches,
and
bad
fatigue.
fever.
Yeah,
high fever. You don't get a fever of 102 or 103
with a cold. Right.
You do with influenza. Influenza can cause, and in kids, of course, fevers can be 105 or so. So that headache is a flu characteristic, particularly headache behind the eyes, as I recall. But I think the other thing is to point out to people that cold viruses usually infect the nose and the sinuses and maybe the conjunctiva of the eyes. The flu virus is an infection of the throat and the bronchial tubes. So cough is a common symptom of the flu. Where you might cough with a cold, you might not. Sore throat, perhaps, but maybe not as prominent as a strep throat, for example. But a sore throat certainly can be part of that. Runny nose is not a big part of the flu.
That is correct. That would indicate that you've got a cold.
And another one is stomach flu. My understanding, GI symptoms.
I don't know. I don't know how that term came out of. It's become so popular when in fact it's not.
And we should mention what we think of as colds, respiratory colds, and many GI illnesses can be viral. So there are a lot of viruses that affect human beings. But what we're trying to say is there's a difference between many other viruses and influenza.
And influenza. Well, with the common cold, I think the last time I read there's perhaps 200 viruses out there that has the ability to cause a common cold.
And now influenza, we do have ways to prevent it. I mean, let's go over once more time.
With getting a flu shot, a very good way of helping prevent the flu, and if you do get it, to minimize the effects of it.
And flu also tends to be, or influenza, seasonal. It really runs as an epidemic.
Yes.
There are a few, I think if you look hard, you can find a sporadic case here or there all year. But as a whole, flu runs in a cycle, so we know when it's in the community.
Yes, we do. And because the health departments track that, the hospitals for people that are admitted, we have to report those incidences. And again, it's that the time frame that the CDC sees is that the January, March, and December time frames. They're big times.
Do we understand why flu occurs mainly during those winter months?
You know, certainly, I think people are indoors more. You've got the heat on. You know, your nasal passages may be drying out. You know,
and maybe
I
that
think,
a lot. Yeah, I think I'm about where you are. Do you know any more than that?
No, although, you know, the flu travels around the world seasonally.
Yes, it does.
So it often starts in the other hemisphere and kind of travels here. So some of it, I think, is the variability in that.
And because it's not a big deal anymore to get on a plane in, say, Buenos Aires and fly to New York City. You're there in a few hours. You have the ability to bring the virus with you. It's not like you're on an old-time cruise ship where it took you 2 weeks to get from one part of the world to the other.
So what are the recommendations this year? Who should get the flu shot?
Everyone.
It's real easy then.
It's real easy. Everyone should get a flu shot. There's no reason not to take it.
And the nasal flu shot, or I should say the nasal flu immunization that was available last year?
Will not be available for this coming season.
And why is that?
Just, when looking at the data, people were not protected enough with the nasal product.
So unfortunately, it does mean everybody needs to get that shot.
Even
Everybody,
kids.
and
right.
it's a tiny needle. It's not, it's.
I always find the soreness after the needle more prominent than the needle itself, which I don't ever feel, I think.
So if you're right-handed, get it in your left arm. If you're left-handed, get it in your right arm. So you're not, there's lots of ways to get around it.
Just to highlight, the flu shot is recommended for pregnant women.
Yes.
It's safe and effective.
It is safe and effective.
And those antibodies will also be passed on to her infant.
To the infant.
For that season. So if you have a baby
Which is
born in
very
the
helpful.
winter, you'd like your baby to be
Immunized, yeah.
immunized against
Grab the
flu.
mother's protection.
Could we just say a couple of words about, there is treatment out there for the influenza virus after you've got it,
Right.
but it has a certain limitations to its utility. Could you say a few words about that?
There's oral medication out there, and there's some nasal sprays. I'm sorry, not nasal sprays, but oral inhalers that you can take that will alleviate some of the symptoms, but you have a very small window. If you wait 3 or 4 days after you come down with the flu before you go to see your physician, it's almost not worth it, taking the medication, because you've reached the point where you're going to just naturally start getting
That's an
better.
important point.
Are 48 hours recommendations?
I believe it's 48 hours.
Symptoms.
Yeah.
So this is another reason to recognize the flu, that if you've got the flu, particularly if you're a diabetic, you're older, you're younger,
You have lung disease or heart disease.
you should absolutely see your doctor and get a prescription for an anti-influenza. And this is not
Right.
the over-the-counter stuff that we see
No,
advertised.
it's most of those products are just either acetaminophen or aspirin.
Right.
But you need to see your physician to get a prescription.
And so if you do have a significant fever, these body aches, severe fatigue, the cough, call your physician as soon as possible.
And
it's better to call, get seen, or discuss it with your physician. Don't necessarily wait to see if it lasts,
Right.
because by then it may be too late to be effectively treated.
And then again, because it is a virus that tends to attack the lungs, people with other medical conditions do have a tendency to develop pneumonia.
Yeah,
Right.
I certainly
And
remember.
that's something else that you can do without.
I will never forget, during my internship, I saw a young man. We admitted a young man to the hospital. He was a diabetic, but he was a healthy diabetic who got influenza, got super infected with another bug. I don't remember. I think it was staph, and he died. And it was just shocking to me as a new doctor to watch somebody who was treated in a modern hospital with all the modern methods die of the flu, and all he had was underlying diabetes.
And I think that's an important point, because influenza itself can cause a pneumonia. It can cause inflammation in the lungs, and therefore difficulty breathing or difficulty with oxygenation of your blood. But it can also increase your risk for getting other bugs, especially staph bacteria, that can cause a pneumonia as well.
And then you put the body under a terrific strain. It's trying to fight the flu. Now it's got to fight additional things with the bacteria, pneumonia. And so why take it, why do it?
And so if you are having symptoms consistent with the flu and shortness of breath, that's an indication to get in and be evaluated right away.
You need to see your physician.
What other things can people do to help prevent spreading the flu?
Stay home. Use those sick days.
That's tough to do.
I
think that's why I think it's important
Especially
to say that here.
This 24/7 society that we live in, where there's no downtime.
Right.
It's go, go, go. The iPhone, the iPads, the computers at home.
And the bosses who expect to see you
exactly.
every day.
Right.
But you've got to stay home. All you're
How
going to
long
do
do you
is,
have to stay home for, Bob?
I would say, till you start feeling better. It's probably going to be 5 to 7 days, and you're better off erring on the safe side.
So don't be a hero.
Right.
Don't be a hero. And if you have been diagnosed with influenza, there may be, especially say in healthcare, there may be regulations about when you can come back. Check into that as well.
Absolutely.
Right, and then stay away from people who are at risk. Again, the very young, the very old, people with chronic illnesses.
Right.
It's not a time to spend those 7 days with your grandchildren.
Right. And it's it's challenging because a day before your symptoms show up, you can be infectious. And so you don't even know it. And so once those symptoms show up, stay away from everybody.
This is such important advice, and this is such a major health problem. Kills so many people, and yet we all sort of treat it as a nuisance. And I think it's important to recognize this is a serious illness. Bob, unfortunately, we have to wrap this up. It's all the time we have. I want to thank you for coming on the show and discussing such an important topic.
Viewers, please do email us with your questions and comments to healthtalk@wchn.org. Eric and I would love to hear from you.
Thank you very much for watching.
Get a flu shot.
Yes.
Stay well.